Good day, everyone. I'm Alexander James Y. Palad. So, for today, I'm going to show you the proper procedure of the application of cold therapy. So, the purpose of this assessment is to slow or stop bleeding, slows bacterial activity in clients with infection, it reduces swelling in injured tissues, including sprains and fractures. It controls pain and fluid loss in the initial treatment of burns. It prevents peristalsis in clients with abdominal inflammation. It prevents also escape of heat from the body by slowing circulation, which also relieves congestion. So for the assessment, we need to identify the patient using at least two identifiers. Refer to a healthcare provider's order for type, location, and duration of application. We need to perform hand hygiene and inspect condition or of the affected part. Palpate the area for edema. Consider time elapsed since injury occurred. Ask the patient to describe severity and the character of pain. We need to perform neurovascular check, inspect surrounding of the skin for integrity, circulation, the color, the temperature, and the sensitivity to touch. We need also to review medical history for condition that can contraindicate use of cold therapy. Assess the patient's LOC or the for the responsiveness. We need also to assess the patient's understanding and awareness of procedure. So for our planning, we need to identify the expected outcomes, prepare all the tools and equipments that we're going to use in this procedure, and explain the procedure and precautions to our patients so that they are aware of what we are doing and what's coming next. So for our planning, we need to identify the expected outcomes, prepare all the tools and equipments that we're going to use in this procedure, and explain the procedure and precautions to our patients so that they are aware of what we are doing and what's coming next. So for the implementation, first we need to introduce ourselves to the patient and verify the client's identity, explain to the client what you're going to do, why is it necessary, and how the client can cooperate. Explain the step of the procedure and purpose to the client. So, good day, ma'am. I'm Alexander James Y. Palad, and I will be your nurse for today. Can I know your name? Okay, ma'am Violi. So, how old are you? Okay, so after getting the information of the patient, we will now provide privacy. So as you can see, I already closed the window, I already closed the door, so it is safe now to proceed to our procedure. Okay, so after we provide privacy to our patient, we will now perform hand hygiene and we will now wear our gloves. Okay, so I'm going to perform hand hygiene and I'm going to wear my gloves. So after wearing our gloves, we will now position the patient properly. Expose the area to be treated. Drape patient with blankets. So, ma'am, I'm going to position you po. Ma'am, saan po yung um, infected body part niyo po? Okay, so dito po. Okay. So, ma'am, pwede pong i-rate niyo po yung sakit na nararamdaman niyo po ngayon. 1 to 10. 7. Okay po. So, masakit po siya, no? Okay, so, gaano na po katagal yung nararamdaman yung sakit na yan, ma'am? Okay po, sige po. So, ngayon po, i-apply ko po yung cold compress para po mabigyan po ng relief yung masakit po yung infected body parts. Okay lang po ba sa inyo yun, ma'am? Okay. Place towel or pad under the area to be treated. Okay, so I'm gonna using this waterproof pad under the infected body part of my patient. So, ma'am, I'm going to place it here. Then, place ice water in basin. So, we need to test the temperature. So, here is the cold solution. So, I'm gonna pour it in the clean container. So, after pulling the solution to the container, I will put a gauze. We have gauze here, and we will put in a clean container. So after we put the gauze in the container, we will now exhaust out the excess water. Okay, so we will now get a single layer of the gauze. Okay, so I'm gonna place it, ma'am. So I'm gonna apply it on your infected body parts so it gives relief to your muscle. Okay, so remove, re-moisten, and reapply to maintain temperature as needed. So if the time duration of the gauze, then we will re-moisten this gauze to the container so the temperature will remain as needed. Okay, so are you feeling comfortable now, ma'am? Do you feel any pain? Do you feel any relief as I put the gauze in your infected body part? Okay, that's good to hear. Okay, so apply ice pack or bag. Okay, so here we have a ice bag. So fill the ice bag with water, secure the cap, invert the bag. Okay, so I'm going to fill it with water. Then I'm going to secure the cap here. Then I'm going to invert the bag. Then we need to empty the water. Okay, so I'm going to open it and I'm going to place it on a proper receptacle. Then after we empty the bag, we will now fill with ice chips and a slight water. So I'm going to give a ice chips and a slight water. So express excess air from the bag. So we need to remove the excess air, then secure the bag. Okay, so squeeze, then secure. Then wrap the bag with towel and apply over the infected body part of our patient. We will now wrap it with our towel. Do you feel any pain, ma'am? Do you feel any relief? Okay, that's good to hear. Gumiginhawa po ba yung pakiramdam nyo? Or naiibsan po ba yung sakit dito sa part ng kamay nyo, ma'am? Cut mo. So apply commercial gel pack. So we have here a gel pack. I get it from the freezer. So wrap in towel, apply over in injury. So I will wrap it with our clean towel and apply it on a infected body part. Okay, so secure with tape or gauze as needed. So since we don't have a micropore tape, let's assume that I have tape and we will secure the gel pack to the infected part of our patient. Okay, so do you feel relaxed, ma? Okay, so that's good to hear. So after applying the gel pack, secure it, then apply electrical controlled cooling device, prepare device appropriately, ensure all connections are intact and temperature is set. Wrap cool water flow pad in towel or pillowcase. Wrap cool pad around body part, turn device on and set correct temperature. Secure with the elastic wrap, bandage, gauze roll, or ties. Then after that, we will now remove the gloves. Okay, so then perform hand hygiene. So check the condition of the skin at appropriate intervals. Use extra caution if area was edematous. Assess site more often. Stop it if the patient complains of burning, sensation, or skin began to feel numb. So, ma'am, do you feel any burning or any pain so that we could stop this assessment? Oh, okay. So the patient seems to be no complaint, so it is safe now to continue our procedure. So apply clean gloves again, then remove compress or pad at appropriate time, dry in moisture. Okay, so I'm going to wear our gloves again. So I'm going to wear it. Cut. So after applying our clean gloves, remove the compressor pad at the appropriate time. Dry any moisture. So ma'am, I'm going to remove the gel pack. I'm going to remove this gauze. So after removing, ma'am, I'm going to remove the pad also. So after removing and drying the moisture of the patient, we will now help the patient to comfortable position. So ma'am, can I help you to a comfortable position? Okay, so after helping the patient on a comfortable position, remove and dispose of supplies, empty basin and dry dispose of soiled linen and gloves. Perform hand hygiene. So I already clean the basin and of course this. Okay, so for our evaluation, inspect affected area for integrity, color, temperature, and sensitivity to touch. Reevaluate at appropriate interval, palpate affected area for edema, bruising, and bleeding. Ask the patient to report pain level. Ask the patient to demonstrate how to apply ice pack. We need to identify also unexpected outcome. So for our recording and reporting, record procedure and patient's response in the appropriate log. Document evaluation of patients or caregiver learning. Report any sensations of burning or any numbness or unrelieved skin color changes to healthcare provider. That's all. Thank you for watching.